Hey everybody, Dr. Wenzel, Brentwood MD. Welcome to video 2 of a 3-part series, all on performance in the bedroom for men beyond the age of 40. In the last video, we talked about the want to, which is bucket number 1. In this video, we're talking about bucket number 2, which I call the parts. The parts for a man really, if we think about the analogy of construction, are plumbing and electrical. That's really what enables a man to physically engage in sexual activity. The things that are the primary contributors to dysfunction or suboptimal performance, far and away, smoking is number 1, and then diseases of metabolic disease like hypertension, type 2 diabetes, or even poorly controlled type 1 diabetes with enough time, obesity, medications, a lot of blood pressure medicines, antidepressants. There are several classes of drugs that are notorious for affecting the plumbing and electrical components of men's performance. I kind of lumped in alcohol because there are so many men who underperform and they're completely blind to the impact alcohol is having on their performance. So that's there. And then age. As men age, there is a wear and tear on the plumbing and electrical system where inefficiencies like leaky valves, inability to optimally plumb and electrify the parts just don't work as well. The way we approach this, if we identify that this is a parts problem, is we modify the modifiable risk factors, just like we do in any disease modification strategy. We can't do anything about your age, but if you're smoking, you should stop. Modify the things you can modify. Lose weight, get control of your blood pressure, get control of your diabetes, stop over consuming alcohol, see if there are other medication alternates that we can use that don't have this type of impact. So change the things that you can change is step number 1. For many men, adding a Cialis or a Viagra type medication is more than enough to kind of bridge the gap between where they are and where they desire to be performance-wise. If that isn't enough, or you can't tolerate that, there are a fair number of men who can't tolerate those class of medications. There are more extreme techniques if necessary, but you would really want to see a urologist for that. Everything from rings to injections to pumps. There's a whole spectrum of not so common but certainly options for men who need them. So this concludes video 2 of around bucket 2. We talked about the want to, we talked about the parts. In the next video, we're going to talk about the last bucket, which is the relationship. I can't wait to see you in that video. Take care.